Good evening, everyone, and welcome to another hour of Healthy Conclusions, where we try to give our listeners important information on nutrition, exercise, and holistic, alternative, and integrative medicine. Please take a minute to visit our website at www.healthyconclusions.com and like us on Facebook. My name is Bob Neugebauer, and I will be your host for this evening's show. Tonight's show is being brought to you by Altrua Health Share, which has been serving its members and their families with their health care needs since 1997. Please take a moment to visit their website at altruahealthshare.org or call 888-244-3839 to see just what Altrua Health Share can offer you and your family in their health care needs. It may mean substantial savings to you. We would also like to take a moment to invite those of you listening to join myself and Dr. Stephen Baker, along with other integrative medicine practitioners, for a seminar on cancer and the use of alternative therapies on Saturday, November 4th from 10 a.m. till 2 p.m. at Friendship Celebration Church at 765 East Chinden Boulevard in Meridian next to Zamzows. For more details, please go to our Healthy Conclusions Facebook page or the healthyconclusions.com website. Our guest for this evening is Dr. Jeff Hartford. Dr. Hartford is a family medicine doctor in Boise, Idaho. He received his medical degree from the University of Washington School of Medicine and has been in practice for more than 20 years. Dr. Hartford is unique in the fact that he has both a medical degree and a degree in naturopathic medicine. So, Doctor, it's a pleasure having you here with us this evening. I understand that you were a regular allopathic MD for many years and then decided to go back to school and become a naturopath. This is a very serious 180-degree turn for someone like yourself. So why did you make the decision to become a naturopath?
Thanks, Bob. Thanks for this opportunity to speak. I did my medical training at the University of Washington between 1982 and 1986. I was able to come do my family practice residency here in Boise between 1986 and 1989, and I stayed in Boise since then studying family practice. At the latter part of my allopathic career, I personally decided to approach the huge opiate problem in this country and became board eligible in addiction medicine. I was continually frustrated with the Idaho State Board of Medicine's interference, and I actually surrendered my medical license. I retrained and got my naturopathic diploma actually out of India, and the important training to my current naturopathic I received at Bastyr University in Seattle under the direction of Dr. Dietrich Klinghardt, who is a German physician who teaches a type of muscle testing and a psychological technique that complements things I've done in the past called applied psychoneurobiology.
Now, Bastyr is one of the more prestigious colleges around here. What made you choose that?
It was mostly I chose Dr. Dietrich Klinghardt for his instruction. And it actually wasn't through Bastyr University. It was a certification conference I attended there.
I see. Do you find the field of naturopathic medicine more challenging, and have your former relationships with allopathic colleagues changed at all since you've become a naturopath?
I've kind of fallen out of the active community, and in fact, being in Boise as an independent family practitioner has always been a struggle, especially when we got to the point that the two hospitals in town were buying up private practices, and doctors no longer worked for their patients. They were now employees of the hospital and had to satisfy their new employers. I had never wanted to enter into that practice model.
Do you see that, the fact that we only have two hospitals and things are kind of in my thought process, circumspect, the fact that we don't have a lot of what I could call freedom, health freedom in terms of choices. Do you see it as a detriment to the Treasure Valley, and is that something you think we can eventually work out of by bringing new hospitals in? I mean, we lost the Treasure Valley Hospital to, I believe, St. Luke's. How do we change this? How do we move it around? How do we make it better for the people with more choice?
This scenario of big hospitals buying up practices and medical facilities has been done down in Utah years before it's been done here in Boise. There's lots of advertising. There's lots of clinics for competition, and people continually get directed back into the allopathic network. We have a great community of alternative and complementary practitioners in this valley, and I remember as an allopathic physician, I always told my patients that they were wrong. That kind of science has no evidence-based background. And in my new training, I've learned that most of the science that alternative and complementary practitioners use actually is strong quantum physics science out of the 1920s and 30s, which has been buried under the carpet by the pharmaceutical industry.
So you believe, as I do, that once the pharmaceutical industry got their people on the boards of these medical colleges, all they were teaching them is pharmacology rather than nutrition, which used to be the old school.
We're actually trying to undo the Flexner Report, which was 100 years ago, where Carnegie and Rockefeller hired someone to go to all the medical schools and find out the ones who were willing to teach the pharmacological method, and they received funding and support. We lived under that for 100 years, and we're now at the point where it's obvious it doesn't work, and we're ready to go back and allow alternative practitioners who work in energy medicine, which is the allopathic practice I used to have is Newtonian physics. Apple falls out of the tree and it falls and lands on your head. Most alternative and complementary practices rely on quantum physics, which came from Einstein, and so I was certainly skeptical about energy medicine and doing examinations in that way, but now that I've been doing it a few years, I wish I had been trained this way as an allopathic physician.
So as a former allopathic physician, did you find it very difficult when you started to accept the concepts of naturopathic medicine, or were you just kind of naturally drawn to it because of its conceptual simplicity?
Undoing my decades of education, which was truly pharmaceutical brainwash, I found it refreshing and exciting to return to what's most important in a doctor-physician interaction, which is listen to the patient, take a good history, and do a physical exam. I recall that was the beginning of every lecture in medical school, and I'm afraid these days a lot of primary care providers simply have an idea of what you have and what prescription to prescribe when you walk in the door, and then they order a battery of lab tests or imaging studies and rarely listen to the patient and hardly ever touch them.
Do you think we would have a better healthcare system in this country if we combined the best of allopathic and naturopathic medicines to a practice of integrative medicine?
Certainly. I think residents of Idaho and Boise should be able to keep their health freedom and choose alternative choices to their medical care. So much of allopathic medicine is fear-driven, and it's about power and money.
So you're pretty much of the same ilk that I am. That I have. I've spent many years avoiding doctors, to be very honest with you, and until I hit Medicare, and then all of a sudden they want you to come take a physical every year. But the unusual part of that is I get to see the doctor for maybe 15 minutes. In most cases, I don't think he remembers my name. He certainly doesn't remember what I look like. And if it wasn't for the chart, he wouldn't really understand anything that was wrong with me. Would you agree with that? They just do not take the time anymore?
I'm sure most current practitioners would love to take the time and sit and talk with their patients, but they are not working for the patient. They're working for the hospital, and they have to keep a schedule. They have to meet production numbers, certain levels of income to get bonuses. And so the system is just backwards.
So this becomes a money thing.
It's very much a money thing. The archetype of the doctor-patient relationship has been totally suppressed and ignored.
Do you think because it is a money thing that's one of the reasons we have seen our health care in this country deteriorate year after year, and the cost to help people go continually up?
The problem isn't simply allopathic's approach, a pharmaceutical approach. We live in a very toxic environment now. The heavy metals have been brought up out of the earth and are in our environment. I live out in Canyon County where there's lots of farming, and the amount of pesticides and Roundup sprayed on our food, and our food has been genetically altered, and it's not the same food we ate when I was a child.
How do you feel about this genetically altered food? I know I've changed and gone to just organic for the past 2 years, and I've noticed the change in myself, in my body, and how I feel, and it has been much better. Do you think that the GMOs that we are basically pushed into eating are hurting us and hurting us badly?
They're hurting us and hurting us badly, and it's a very pernicious and subtle process.
I'm going to take a quick break here. If you can just give me a minute, we'll be back. You're listening to Health Conclusions, brought to you by Altrua Health Share, with your host Bob Neugebauer on 580 KIDO and 107.5 FM. Welcome back to Health Conclusions on 580 KIDO. We're speaking with Dr. Jeff Hartford. Jeff, let's continue on. We're talking about integrative medicine. We're talking about allopathic medicine. I'd like to talk a little bit here. Health costs have risen to a level now that most people can't afford to use their insurance, even if they could afford to purchase it because of the deductibles. In all the studies I have examined, alternative and complementary medicine, they have shown time after time that they can cut the costs of care by as much as 30 to 40% with better outcomes. Would you tend to agree with this?
I totally agree with this. Naturopaths in Idaho aren't currently licensed. Last time a bill came before the state was in 2005, and it didn't become law. Naturopaths have been approaching the Idaho State Legislature yearly since then, and we have a bill prepared to take to the Senate to try to get passed to get naturopaths licensed. I think this licensing will mostly protect him from competing boards such as the Board of Medicine. We're in line with the Board of Chiropractic. We agree with the Board of Nursing that nurse practitioners should maintain their independence from medical doctors. And so insurance doesn't cover naturopathic services in Idaho, and we typically charge fee for service. There are some procedures that I do which are legal in the state of Washington. I was trained that way by Dr. Klinghardt. It complements my previous training. And because we're not also paying the hospital to see a patient and ordering other lab tests, we are able to do procedures and spend up to an hour with the patient for probably a quarter of the price.
So you believe it's critical to spend the time with the patient, to get to know them, to understand what their problems are, and that this indeed, along with the different alternative and complementary medicines we use, are more efficacious and yet less costly than the traditional allopathic means.
They're more effective, certainly much safer. They don't take you off on working up a negative finding with the fear and panic involved with that. The doctor-patient relation gets focused on and developed, and I believe a lot of healing comes out of that relationship.
Well, when you focus on somebody, do you just focus on the physical aspect, or do you try to get to understand the problems this person may have sociologically or emotionally or mentally?
I believe a human body is a totality. There is the physical body, the spirit, and then there are higher aspects of energy that I don't get involved with. I'm a doctor. I'm not God. That is a separate relationship. I was always interested in psychiatry, even as a family practice doc. I worked for 10 years doing medical consults at Intermountain Hospital. And these days, seeing a psychiatrist is usually a brief visit to be put on more medications.
How do you feel about the medications that we've been giving people nowadays? I mean, it seems like every day there's a new drug that comes out, but they don't always perform. The new drug will come out today, and 30 days from now there's going to be an attorney on TV saying, we know there's a problem with this drug, call us.
Yeah, you can't watch TV without being inundated with pharmaceutical advertisements or advertisements from attorneys helping you collect damages because you took a pharmaceutical. The things that alternative and naturopathic doctors use are from nature. Basically, they're minerals, they're vitamins that are typically in higher doses than the RDA, which is basically a government guideline which is an indicator you're not going to get a specific vitamin-related deficiency. I've been surprised since switching to this form of practice that I'm now able to supplement vitamin D levels up into the high range of normal. People's energy, every health indicator improves if we take a natural approach.
How do you feel about vitamin D levels? Everything I read seems to indicate that most people are deficient.
Most people are deficient, and what I was taught as an allopath does not correct the problem. People stay in the low normal range. Naturopathic medicine has looked further back in history at other studies. Vitamin D is a fat-soluble vitamin, and it's possible to be toxic. However, if you do a large loading dose, maintain higher levels, get out into the sun, we can get up into the higher limits of normal. And actually, vitamin D does many more things than prevent osteoporosis. At very high levels, it probably protects you from cancer. It improves cognitive and muscle function, improves balance and strength in the elderly.
So when you say it's fat soluble, is it better off that we should be eating the better fats? I know for years they've said, don't eat fat, it's bad for you. What they really were saying is don't eat the vegetable oils, especially the hydrogenated ones.
I think allopathic medicine has been on the wrong track with the treatment of obesity and diabetes, and I think this is confirmed by the fact that those conditions are rising in prevalence throughout the country. When I was a little boy, I was taught to eat the fat on the steak because that's the best part, and then I spent 30 years of education telling me the opposite. If you look back at cultures on this planet which live the longest and have the fewest diseases, they typically are on ancient diets, which is high in animal fats, consistent with the paleo or ketogenic diet.
You know, I've studied alternative and complementary medicine for a couple of years now, and I'm very involved in trying to convince our legislators that integrative medicine is the way to fix the broken system. Would you agree with that, and why?
I totally agree with you, Bob. Health insurance costs go every year. Patient satisfaction with their medical care decreases every year. The huge opiate problem, which developed in the early 90s, is just getting worse and worse and worse. So there needs to be a re-education of the problem without impact from allopathic medicine and the pharmaceutical companies.
What would you say are the three primary differences between allopathic and naturopathic doctors, especially in the way they examine and treat patients?
Naturopathic doctors have a broader perspective for diagnosis and therapy because they acknowledge that there is an energy aspect to a person's body and mind. And I think there are more interventions which can be done energetically without putting a foreign substance in a human's body. And just everything in allopathic medicine is an anti-something. It's antibiotic, antihypertensive, and it blocks a process in the body. Naturopathic processes correct deficiencies, help get rid of toxins from the environment, possibly heavy metals, and then nurture the system back into a healthy way of functioning, which is how nature intended.
Currently, there's a movement afoot by the Attorney General's Association, along with the AMA and several other powerful organizations in the medical field, to push insurers into covering integrative medicine when it comes to chronic pain because of the opioid crisis, which you talked about earlier, that is killing 60,000 Americans a year. What is your opinion on this matter, and do you think integrative medicine is better equipped to handle the chronic pain rather than the use of opioids?
Alternative and complementary is much better in handling chronic problem because they address the whole person rather than refilling their prescriptions monthly. They use a variety of approaches. We might use exercise physiology along with acupuncture, along with chiropractic manipulation, supplementation of minerals that most all of us are deficient here in Idaho, such as magnesium, zinc, selenium, and we strengthen a person. We give some meaning to this battle with pain that they've had for whatever reason. And I've seen many more people return to full functioning from an alternative or naturopathic approach than simply getting their prescriptions filled every month.
Do you think we're ever going to get out from under the thumb of the drug companies basically running the FDA and pumping out all of these different drugs, whether they do any good or not? It doesn't matter. It's just a matter that they want to make money.
The public needs to educate themselves and realize the hold that advertising and public influence has on each of our abilities to make healthy decisions. This movement, I believe, will rise from the grassroots level rather than addressing it from the top, where power and money influence most decisions.
Well, you know, when you take a look at it, our approach to a healthy society is a bit upside down. Those who are involved in healthcare have built an entire trillion-dollar industry around it. And as a nation, we do not try to keep our citizens healthy by any means. It starts with the corporations and using untested chemicals and household products right into the produce food that is genetically modified and sprayed with pesticides, and then a promotion of new drugs. So, you know, you got these things coming at you all the time. How are we going to get away from this when it starts at the corporate level and there's so much money behind it? I mean, this is a serious problem, but it's been going on for 50 years.
I see so many patients that have been through the allopathic ringer for 3, 4, 5 years prior, where they're referred to different specialists, have a multitude of imaging studies and laboratory tests, often get told that they don't have certain diseases, but never understand the process which is causing their discomfort and ill health. And I believe it's now every person's responsibility to decide for themselves what kind of foods they eat to feel the best, have a better understanding how to support others with chronic illness. And we really need to focus on this next generation to let them get things right.
Would you welcome this movement that I see coming towards integrative medicine, though it would mean dealing with insurance companies for services? And I know that most naturopaths and practitioners in your area of expertise cannot claim on insurance currently, and everything is pretty much cash. Would that help? Would that encourage you to do more, to see more patients, to be involved more?
So many people hear my new approach and would prefer to do that, but there's no money left in the household to pay fee for service. A lot of money gets paid into insurance. It's nice if you spend the year with no medical problems, but the money that you paid in is used by industry to take care of other people who have been sucked up by the medical model and basically have become chronic invalids related to their allopathic care and pharmaceutical dependence.
We're going to have to take a quick break. We'll be back in a few minutes. You're listening to Health Conclusions, brought to you by Altrua Health Share, with your host Bob Neugebauer on 580 KIDO AM and 107.5 FM. Welcome back to Health Conclusions on 580 KIDO. We're speaking with Dr. Jeff Hartford, and we're talking about integrative medicine. Doctor, I'd like to talk to you for a minute about how we're going to solve this problem that we have. Health and wellness is all about choices. If we eat products that make us fat and in turn cause our bodies to create spikes in insulin, we all wind up with diabetes and need medical care. However, if we eat properly and exercise regularly and keep our bodies lean and healthy, chances are we're going to live a much healthier life. How do you get people to do that after they have been in this syndrome for years and years of not worrying about this and thinking all they have to do is take a pill?
That's you're dealing with the American problem of a fast fix, fast food. Everything is just full speed all the time, and it's a very stressful way to live. The fast food industry is a huge part of our current health issues, and re-education from a health practitioner often doesn't fit well into a very hectic day. Food is like medicine. Hippocrates first said that. And we need to honor our food by growing our own gardens, collecting our own eggs, looking to organic sources for nutrition rather than meat that's been raised in a warehouse, given antibiotics and hormones to bulk up production. And as each person makes individual choices that are healthier, they realize their health is improving every day. It's a more gradual process, and that's why more frequent visits for guidance, which would be covered at a much lower rate than visiting your allopathic physician, are part of that healthcare model.
Well, so since our health depends on the choices we make, shouldn't we be penalized for making bad choices by having to pay more for health insurance premiums if we smoke, are obese, or are heavy drinkers? And why should those that keep themselves healthy, seldom avail themselves of healthcare services, have to subsidize those that don't care for themselves?
We need to have a way to take care of everyone, and some individuals have been suffering with health problems for so long that they can't continue to work productively. And so it's a little bit more of a altruistic, let's take care of everyone type model where everyone contributes to the system, and then if someone has a problem, they have that available to take care of them. If people could spend more money on healthy foods, use more time to enjoy exercise. We're all trapped in our cars here in Boise. We drive everywhere, which is basically sitting. There are a few lifestyle changes which don't cost anything, which would help bring the health debt in this country down.
Well, you know, one of the most serious health problems we have in the world today is obesity. Whether you believe it or not, 72% of the deaths are from non-communicable diseases. It is obesity and diet that are causing the many high-risk factors for coronary artery disease, the leading cause of death everywhere, along with cancer, stroke, and Alzheimer's. You know, people may be living longer, but they have more serious illnesses in their end years. This is a problem I don't know how we're going to solve, and it is going to cause us basically to go broke at some point in time if we continue with Medicare the way it's going.
At some point, the system will be broken, and there will be no money left to take care of anyone. And the education about obesity and diabetes has been wrong. Carbohydrates are not a necessary fuel source. And so going back to ancient ways of eating, which means intermittent fasting, relying more on animal products and vegetables rather than any type of processed food, has not been in the educational model of allopathic medicine.
We also have a problem, over 1 billion worldwide who are suffering from mental health disorders and substance abuse are not getting proper care. How do we solve this? This is a worldwide problem. and I don't see anybody trying to solve it, especially in the mental health area.
My education as a naturopath has been so much more enjoyable and enlightening than simply working with neurotransmitters and processes that can be impacted by chemical pharmaceutical products.
One of the dichotomies between naturopathic and allopathic medicine is the fact that naturopaths use natural means to solve medical problems, and a lot of that has to do with diet. Could you tell us how important you believe diet is to a person's health and the healing process?
Diet is kind of the cornerstone. The primary source of production of neurotransmitters in the body is actually not the brain, it's the gut. And that production of neurotransmitters is certainly influenced by healthy digestion. There's a condition I was never taught about as an allopath because there was no pharmaceutical drug to correct it, which is leaky gut syndrome. Going back and looking at the type of things that can leak out of our gut into our bloodstream, such as molds, bacteria, toxin, heavy metals, was not even addressed in my allopathic training. I believed if bacteria or fungus were in the bloodstream, a person would become septic, have to go in the hospital, be on steroids and antibiotics. And actually, we realize our bodies carry around vast numbers of bacteria, which influence our gut biome, influence our vitamin production, our ability to maintain integrity of our gut lining. Each human body is more of a symbiosis of organisms working together to allow our mind and our spirit to function in this body we have for a limited period of time.
So what you're saying to me basically is that we don't address the root causes of our problems. And, you know, if you had a primary physician that saw you regularly, they would be able to tell you to stop all of the house cleaning products and the toxic chemicals and switch to those that are non-toxic, and stop eating genetically modified food and buying products that are less than organic. They'd also probably tell you to start an exercise program or take 10,000 steps a day. All of these would make you healthier. And I have always believed that you need to re-educate America. Is that where you're coming from? Is that it's a re-education process that's going to take decades?
I totally agree with you, Bob. We've been on the wrong path in this country for 100 years, and we're finally to the point where we're bringing back other modalities of healing, other avenues to health that we had 100 years ago before all of the modern conveniences which have contributed to our decline in health.
So what if you had a physician that you paid a monthly fee to for care? This way you can call him whenever you need to visit or when you're sick or worried, and you don't have to worry about a copay. And this physician would also get to know you, be able to help you recognize your health problems before they become serious, and actually help educate you, because I believe that that's what physicians are there for. They're there to educate you. I haven't found a lot of allopaths that have educated me very much, aside from taking pills. All of these things seem to be positive. Why don't we have a system like that?
Most health insurance won't cover a system like that. I was exposed to that concierge model of allopathic medicine where a group of patients would support a practitioner, knowing that they would be available to handle phone calls, be able to get them into clinic within that month. And I believe that model is a return to that archetypal relationship of a person with a wise doctor to help them with education and to guide their choices.
Well, I tell you, I do believe education is a process, and that's one of the reasons that we started this show about 5 months ago, is to try to educate people. The thing that I see the problem with is that we do not have true freedom in healthcare choices, and we are pretty much stuck with what we have. I'd like to get back to our eating habits and talk a little bit about the ketogenic diet. It's becoming very fast one of the more sought-after diets. People want to understand it more. It seems to keep you healthier, and it helps you resolve many types of diseases. How do you feel about this diet, and do you recommend it to your patients in your practice?
At the clinic where I'm currently working, Energetic Health Center on Orchard Street, we're developing some modalities which improve cognitive function and systemic energy. And so we're looking at combinations of concentrated oxygen with exercise, neurofeedback, which is a type of biofeedback that retrains the brain and gets the correct parts of the brain to function as they were designed to, and then switching from our current carbohydrate-laden diet to a diet rich in fats, medium-chain triglycerides, which allow our bodies to naturally produce ketones. Science has finally gotten to the point where there are some exogenous ketones which can be supplemented to help you achieve that state of ketosis. There's a lot of fear just in the setting of diabetes, but if you go back and realize it's the high glucose problem, which comes from processed foods and carbohydrates, that problem diminishes. Ketones decrease your insulin resistance. Ketones allow you to burn fats for fuel for your brain, your heart, your skeletal muscles. It's a difficult type of diet to follow. It's been around for 100 years. I was trained as an allopath that we can treat children with drug-resistant seizures and help them become seizure-free on that type of diet. So I also believe that being able to get into ketosis will help with a lot of other neurological diseases, such as possibly multiple sclerosis, Parkinson's disease, Alzheimer's disease. I can't recall any good nutrition I was taught during medical school or residency, and I actually learned about the efficiency of a high-fat diet with my endurance horses. Horses don't eat fats, but if you supplement vegetable oil, they can run faster and longer. I believe that's true for human animals also.
Thank you, Doctor. We're going to have to take a quick break. Just one more thing here. I would like to invite those of you who are listening to join myself and Dr. Stephen Baker, along with other integrative and medicine practitioners, for a seminar on cancer and the use of alternative therapies on Saturday, November 4th from 10 a.m. till 2 p.m. at Friendship Celebration Lutheran Church at 765 East Chinden Boulevard in Meridian, next to Zamzows. For more details, please go to Health Conclusions Facebook or healthconclusions.com website. You're listening to Health Conclusions, brought to you by Altrua Health Share and your host, Bob Neugebauer, on 580 KIDO AM and 107.5 FM. Welcome back to Health Conclusions on 580 KIDO. We're speaking with Dr. Jeff Hartford, a naturopath here in Boise. So, Doctor, we were talking about the ketogenic diet and how important diet is in the process of keeping you healthy. Next to diet, what would you say is the most important thing a person can do to maintain and improve their health?
I believe the second most important thing would be to get up and move. The 10,000 steps is a fantastic idea. It'd be nice if we all got out of our cars and shopped locally or dedicated more time in the day to exercise. So probably moving more and exercising more would be second. I also believe a lot of physical problems are related to restricting or limiting beliefs we've been given by our schoolmates, our parents, our siblings, or unresolved psycho-emotional conflict, which by definition is unconscious, which means it's out of our awareness. If we go back and tell a different story about our life where we let go of harms and injuries that we received early in life, even when we were in our mother's womb, possibly things passed to us by our parents, I think we can remove the energy of psycho-emotional problems from physical manifestations.
We're dealing with the baby boomers currently. I guess they're retire and get something like $10,000 a month. They have many medical problems because most of them have not taken care of themselves over the years. What do you find to be the most prevalent problems with this age group, and how difficult do you find them to treat? And how are we going to deal with this problem as they age?
I guess we're getting back to the opiate problem. Probably the main problem that us baby boomers have is pain problems, neck pain, back pain, joint pain. I think that has been a part of our addiction to grains and carbohydrates, but it hasn't been focused on by modern allopathic medicine. And returning to the basics of breathe clean air, eat good, nourishing food, and get out and be active are just not part of our current model.
Well, do you think we're ever going to be able to educate these people to make it our current model? Or is this just something that's not going to happen and we're just going to have to deal with the problem?
I don't think age is a limiting factor. I'm currently working with a patient, and she's 90. She suffered a stroke. She had atrial fibrillation, and she hated to be placed on medications where there was a risk-benefit issue. So if she fell, she would bleed more, but she might not have a stroke. She has turned to supplementing essential oils, using oxygen and neurofeedback to heal her brain, is trying to get over to a ketogenic diet, using ketones to fuel her brain rather than relying on glucose and carbohydrates. So I believe all of us at any age can turn the tide. Age, I think, is an idea we carry in our head, and it doesn't really reflect the number of birthdays that we've had. And she is really exciting to me. At her age, she wants to help other people enjoy the latter part of their life and not be a burden on a caregiver with dementia or other chronic illnesses.
Well, that leaves me some hope. I would like to thank Dr. Hartford for joining us this evening and offering his insights into alternative and complementary medicine. This is Bob Neugebauer signing off for Health Conclusions, and we hope you will join us again at the same time next Sunday for another hour of informative talk. Have a good week.